Question 111. When lifting a heavy object, which muscle groups should be utilized? A. Muscles of shoulders. B. Muscles of legs. C. Muscles of hands. D. Muscles of backs. Answer B. Explanation. When lifting a heavy object, the nurse aid should be positioned to support the client by using the legs. Keep your back straight and locked. Do not turn or twist. Do not attempt to lift by bending forward. Bend hips and knees to squat down. Keep the rod close to your body and straighten your legs as you lift. If you have any doubts, always ask for assistance from a co-worker. Question 112. When dry, hot stool fills the rectum and will not pass, it is called A. Edema, B. Impaction, C. Incontinence, D. Atrophy. Answer B. Explanation. A fecal impaction is a common occurrence in people who have chronic constipation. It is a mass of dry, hot stool in the colon or rectum. The client is unable to pass it without assistance. The stool may need to be removed manually by inserting a gloved finger into the rectum. Enemas and laxatives may also be tried. Question 113. Strokes are seen in the elderly. Strokes are best described as A. When the brain is deprived of oxygen, B. When the lungs fill with fluid, C. When the muscles die, D. When the heart fails. Answer A. Explanation. A stroke happens when the blood supply to the brain is cut off and oxygen cannot reach the brain cells. Strokes are caused by blood clots in the arteries of the brain or when a blood vessel in the brain bursts. Question 114. There are two kinds of restraints, A. Physical and chemical, B. Masks and goggles, C. Chemical and medication, D. Belts and wristbands. Answer A. Explanation. There are two categories of restraints that are meant to protect the client or others. Physical restraints are devices that are designed to restrict movement. Examples are vests, hand mitts, belts, lap trays, or bed rails. Chemical restraints are medications given to control behavior such as yelling or combative behavior. All restraints require a physician's order. Question 115. If the resident is smoking and a nurse aide needs to take an oral temperature, what should the nurse aide do? A. Take a rectal temperature. B. Brush the resident's teeth first. C. Wait 15 minutes to take the temperature. D. Tell the next shift to take the temperature. Answer C. Explanation. Before taking the oral temperature, determine if the client has smoked or had anything hot or cold to drink in the last 15 minutes. If so, wait a full 15 minutes before taking the temperature in order to obtain an accurate measurement. Question 116. A hepatitis B vaccination protects the person receiving it against a disease that affects A. Skin, B. Heart, C. Kidneys, D. Liver. Answer D. Explanation. Hepatitis B is a serious contagious infection caused by a virus, most commonly spread by exposure to body fluids. It can cause both acute and chronic disease. Many agencies and facilities require employees to receive the HPV vaccination series in order to protect themselves and others. Question 117. What is the purpose of using the chain of command in a long-term care facility? A. To be sure residents follow the rules. B. To prevent more jobs in nursing. C. To keep communication about a problem flowing smoothly. D. To prevent residents from going behind the nurse's station. Answer C. Explanation. Every staff member has a role in providing excellent client care. With good communication, each person can work within the scope of practice and allow others with different authority to handle appropriate tasks. In a long-term facility, the CNA reports to the RN or LVN, who report to the Director of Nursing. The facility's administrator and medical director may be the people with the most responsibility. Question 118. The nurse aide is going to take Mr. Health's vital health signs. What should the nurse aide do to get Mr. Health to cooperate and reduce his anxiety? A. Wear disposable gloves for all procedures. B. Gather all equipment before beginning. C. Explain the procedures to Mr. Health. D. Wash her hands before and after her procedure. Answer C. Explanation. Before providing any care, the nurse aide must follow all the standard steps in preparation. Gather everything needed so that you don't have to leave the client's room once you begin. Hand washing is always done before and after each client's interaction. After confirming the client's ID, explain the procedure to the client. Even for routine tasks such as taking vital signs, allow the client to ask questions before proceeding. Question 119. Various factors will change pulse rate. Increased pulse rates can be caused by A. Depression, B. Sleep, C. Coma, D. Exercise. Answer D. Explanation. The heart rate is lowest when at rest or no physical activity is happening. It increases when there is a need for more oxygen. Exercise always triggers a faster pulse. Other factors that raise the heart rate include pain, anxiety, stress, or too much thyroid medication. Question 120. Many elderly residents lose their appetite due to A. Depression, B. Decrease in number of taste buds, C. Social isolation, D. All of the above. Answer D. Explanation. As people age, loss of appetite can be normal, but when ability to enjoy food occurs, there can be several reasons. With fewer taste buds, flavors are harder to detect, more seasoning or happening, appealing aromas may be helpful. People who are depressed or socially isolated often don't like eating. Choosing meals at senior centers or other places can make elderly people look forward to eating. Other causes are medication side effects or dental problems.
Thank you for watching.